It was really a difficult decision to come out and transition and be transgender and own who my authentic self. And I'm very proud of that, but one of the biggest challenges has been dealing with a lack of access to health care. My name is Sasha Bookert. So I identify as transgender, I identify as a woman. I work at a place where I am covered by health insurance, but actually accessing the specific medically necessary health care that I need isn't available because of the explicit exclusions within the insurance policies. Recently, I was at a provider and I went in to have a couple moles checked out, and my mom was always, ribbing me about it and wanting me to get them checked out, so I was like, I'm gonna go check these out. And my doctor was really nice and really helpful and walked me through, this whole process of taking on trans patients, and that wasn't even why I was there, but I was like, okay, I'll work with this, because I felt like it was a positive step forward for them. I got a call about a week later from my provider, and they said, is this Sasha Bookert? And I was like, yeah. And they were like, well, Sasha, have you had the surgery? And it was really jarring, as a trans person, because, it was implying that the sum of my healthcare needs is the surgery, and it was really insulting. And I knew what she meant, but it took me a while to recover, and I responded, no, I haven't had sexual reassignment surgery, which is what I'm sure you're referring to. And she responded by saying, well, we can't cover this then. Being denied this care is devastating, because being transgender is difficult enough, but having the ability to transition to your authentic gender through medically necessary health care is critical, and having access to that would allow me to move beyond this dominant force of needing health care in my life to pursuing a life that everybody else wants. This is a time of my life when I should be thinking very seriously about retirement and home ownership and those significant investments that we should be making at this time in our lives. And I don't feel like my story is that unique. I think that's really similar to what most trans people are going through. There's a lot of misunderstanding about what it means to be transgender in our culture. This isn't, I was born this way, and it's taken me a lot of work to get here where I'm at, and I'm living my authentic life. Yeah, and I just hope that soon we can all live in an Oregon that doesn't isolate one group of people and discriminate through healthcare exclusions because of their gender identity.